Hi, I'm Dr. Jonathan Bingham. I am a board-certified Mohs micrographic surgeon and a board-certified dermatologist with the Benefis medical group. With regard to being a Mohs micrographic surgeon, that basically means that I'm an expert at treating skin cancer. That's a really good question. Any history of any significant kind of sunburn really does put you at an increased risk for developing skin cancer. When patients only seem to get a really bad burn every 3 to 4 years, we sometimes call that a vacation sunburn. And unfortunately, those types of sunburns actually do make people more predisposed to skin cancer, especially the type of skin cancer that we worry about called a melanoma. So yes, if you've had a history of a really severe burn, but it only happens, say, every 3 to 4 years, it would be a good idea to at least have a baseline skin check with a dermatologist. Another really good question in light of some findings that the FDA had. I just want to be clear, though, that the ingredients in sunscreen were not the cancer-causing agents. These were contaminants found in sunscreen, and the specific contaminant was a chemical called benzene. Most recently, after a thorough review had been done, they did not find any further of these contaminants in sunscreen. But if there is a concern about sunscreen ingredients, certainly there are other options. We often think about sunscreens as either being chemical sunscreens or physical sunscreens. And the physical sunscreens would be ones that contain ingredients such as zinc oxide or titanium dioxide. So if you want a sunscreen that does a very good job at protecting your skin, but is also not a chemical sunscreen that you would be concerned about having issues, then I would recommend one of the more physical sunscreens. Again, and you want to look for the key ingredient of either zinc oxide or titanium dioxide. First of all, I really commend people for wearing sun protective clothing. When it comes to sun protective clothing, though, you need to understand that we don't think about that as what's called a SPF, but rather a UPF. And while the designations, at least the numbers, are very similar in that there's UPF 25, 50, 50 plus clothing, it's not exactly the same thing as an SPF, which applies to sunscreen. But with that being said, if you are wearing UPF clothing, especially if it's a UPF of 50 or higher, you really do not need to be applying sunscreen in areas that are covered by the clothing. But with that being said, I think one of the important things with regard to sun protective clothing are nice, big, wide-brimmed hats. So you want to be wearing a hat in addition to those long-sleeve clothing. Just remember, though, when it comes to hats, that if you're someone that's spending a lot of time out on the water, say you're out on a boat, you're fishing, that hat is not going to protect you from sunlight that gets reflected up from the water. So you may want to think about putting a sunscreen on that lower part of your face, especially underneath your chin and on your ears and your neck, because those hats are not going to protect you from sunlight that's being reflected up from the water. I commend anyone for wearing UPF clothing, because the nice thing about that is that, you know, if you're wearing that sun protective shirt, you don't have to worry about reapplying your sunscreen, because if you are not going to wear the sun protective clothing and just rely upon sunscreen for your sun protection, it's really important not just to put it on once and think, okay, I'm covered for the rest of the day. You really want to reapply that sunscreen at a minimum at least every 2 hours. Ideally, you're applying it every hour. So again, it's very important, if you're just using sunscreen, you want to reapply that sunscreen throughout the day. This is a question that comes off very frequently, and the answer, fortunately or unfortunately, has to be, it depends. It depends on your insurance. Some people's insurance allows you to call up a dermatologist's office and call them directly for an appointment or a skin check. Some insurances require that you go through your primary care manager or your PCM. So it really kind of depends on what insurance you have. If you do have an insurance that allows you to schedule an appointment directly with dermatology, the best number to reach us at is 406-455-2831. If your insurance doesn't allow you to schedule directly with us, really the best way to deal with that is to go directly through your primary care doctor. And I would also argue that other than for maybe like a skin check, if you're having a skin problem, say like a rash or warts or those things are usually best at least addressed initially by your primary care manager. And then if they feel that it's something that warrants the care of a dermatologist, then they would make that referral for us. If there is any concerns though beyond seeing about scheduling an appointment with us, another number that can also be reached with any questions or concerns is also to our front desk staff as well, and that can be they can be reached at 406-455-2858. So a couple things to think about when it comes to skin cancer. If you have any type of a skin lesion that is new, not healing, changing, with just maybe the lightest bit of trauma, may bleed very easily or persist and just doesn't seem to want to go away, that could be the sign of a skin cancer, specifically the most common forms of skin cancer, which are basal cell and squamous cell carcinoma. It's fortunate that those are the most common forms of skin cancer because for the most part, those are generally not life-threatening. They're not going to cause a problem to your overall health. There are certain forms of squamous cell skin cancers that can cause problems like that, though. The skin cancer we worry the most about, however, is melanoma. And the reason we worry about melanoma skin cancer is if that one is allowed to grow long enough, it can actually spread, metastasize, and be a deadly form of skin cancer. When it comes to melanoma, we talk about the A, B, C, D, E's of melanoma. And these is just a mnemonic that you can use in order when we encourage patients to do their own self-skin checks every month. The A stands for asymmetry, so if you were to take the mole and fold it in half in any way or other and it doesn't, it's not symmetric with itself, that would be concerning. B stands for border, so a border irregularity. So if it's a nice smooth round border, that's generally okay, but if the border is very ragged, or sometimes what we refer to looks like the coast of Maine, that can be concerning as well. C stands for color, so if it's a nice even light to medium uniform brown color, that's generally okay, but it's when if it has a lot of different colors, so brown, black, blue, red, multicolored, that can be a concern. D stands for diameter, so if it's larger than a pencil eraser, that should be something that's concerning, but even melanoma skin cancers can start out smaller than that. The last letter, E, is probably the most important, and that means evolving. You can also think about it as changing. So if you have any existing mole or brand new mole that seems to be changing, it's getting larger, it's changing in size, it's changing in shape, it's changing in color. Those are all warning signs that could be a melanoma skin cancer. And it would be best to have that looked at and addressed by a physician. And if your primary care doctor does not seem comfortable managing that, then a referral to dermatology would be appropriate. Again, to schedule an appointment, it is 455-2831. But if you have any questions beyond scheduling the appointment, it is 2858. I really appreciate everyone's time today. I thought those questions that you had were wonderful. And please let us know if we can be of any help. Thank you.